Hello everybody, today we want to give you a small presentation on KTC Medical Company Smart Nurse Call System. As you may know, the Smart Nurse Call System is the most advanced nurse call system made by KTC Medical Company. So to introduce this system, we first start with describing the elements. To show you the elements, we first start from management center elements, which consists of a corridor display, which is installed on top of the management center, and then the marquee display. So the marquee display and the corridor display are used to show the location of the initiated call to the staff person. So we have also a staff console. As you see, it has one big LCD that shows also all the information related to the call, initiated call, and we have some options like initiating a CPR code blue, or calling direct to a patient, or having an announcement, paging an announcement, or initiating an emergency code. We have dedicated buttons also to initiate emergency codes, or talking to patients, or watching the history of the calls, monitoring unfinished calls, everything. So the next section is the patient's console. As you see, we have two different sizes of the patient's console. Both of them have speakers for two-way full duplex communication between the patient and the staff. So, and they have the LCDs. As you see, the LCDs show the patient's particulars like name, the name of the physician, cause for being in the hospital. And then we have the volume buttons up and down to adjust the volume of the speaker. And we have the option for RFID card, a presence card, or without the RFID card. And then we have the emergency call button or presence button, and the peer push button, nurse call switch here, or a patient's handset that has the membrane keypad for controlling the TV, radio, or controlling the light, and the input 5mm jack for the headphones. So at the corridor or room section, we have the pull cord switches, as you see, and the cancel presence switch, which comes next to the door, and also the corridor status lights. The corridor status lights are on top of the door to show the status of the patient in the room. So now, to show you a small demonstration of the function of this nurse call system, we start by initiating a normal call to show you how the system works. So if I press the normal call button, as you see, the overdoor corridor status light changes to green, showing that we have a normal call. And on the display, on the staff console, you see that room number 3, bed number 3 is marked as a normal call. And here the light, the notification light for visual notification of the staff, becomes red. So I can query this call, meaning that I can just talk to the patient, hello, hello, and when I hang up, the light goes away and the call is acknowledged. So let's make another scenario. If I have a normal call again from room number 3, bed number 3, and then the nurse or the patient decides that he has some emergency problem. By pressing the emergency, as you see, the chime, the acoustic chime changes, and the color of the light becomes blinking red, showing that this is an emergency call. And at this point, if I query the call, as you see, the call is not acknowledged. So as you see, we have the blinking red color is still going on, although the call has been queried, but it didn't disappear. And then, if you look at the staff console, you see that the call has been marked as unvisited, and the emergency is blinking. So this means that the nurse should go to the patient's bed and use the RFID card to change the status as yellow, the red corridor light as yellow, the status is nurse presence. So at this point, if the problem is solved, the nurse can cancel the call or call for the emergency. So if I cancel the call, as you see, the light is turned off and the call is disappeared from here. This means that the call has been acknowledged. So this is a small presentation of call priorities and the levels of call in the smart nurse call system. Thank you very much for your time and have a nice day. Bye.